Hello, everyone. Thank you for coming online today. I am Dr. Hitsugi, the director of Muse City Clinic in Saitama, Japan. I'm very happy and honored to be given the opportunity to participate in today's 51st International Society of Orthomolecular Medicine. I've prepared a very short video clip of our clinic to give you an idea where I work.
お悩みを抱えてお見えになるわけですから、そのお気持ちに寄り添うこと、それが一番大切なことだと思っています。アンチエイジングからアクティブエイジングへ、美容医療と再生医療で皆様の未来の健康に貢献いたします。
I hope that gave you an idea what our clinic is like. At our clinic, we provide a variety of therapies from regenerative medicine, pain management, anti-aging, cosmetic dermatology, and orthomolecular therapies. I am an anesthesiologist. I've been with patients who suffer from chronic pain over years. Today, I'll be speaking about the efficacy of multidisciplinary approaches in chronic pain by going through effective therapies that have improved patient based on our approaches and experience at our institution. My clinic in Saitama, where it's considered a part of the greater Tokyo area, there are quite a few university hospitals where you can get advanced medical care and treatment. However, many of the patients are sent to our clinic by their doctors because there's nothing more they can provide within their hospitals that will ease the patient, including pain. Even for us, even with the advanced medical technology today, it is very difficult to visualize the severity of pain. Having said that, at our clinic, we try to sense each patient's pain through the background of their lives, including the lifestyle, family surrounding, education, occupation, and hobby, and etc. We try to sense each patient's pain by how the pain is described by the patient and figure out the focus and the cause. Or seldom does it have no focus or cause when there is a complex mixture of disorders involved. I'd be very happy if you can catch some of the tips by joining today and utilize as for your daily practice from tomorrow. International Association of the Study of Pain, IASP, is a leading organization globally in the study and practice of pain and pain relief. The definition of pain from IASP is an unpleasant sensory and emotional experience associated with, or resembling that associated with, actual or potential tissue damage. And it's expanded upon by the additional keynotes and the etymology of the word pain for further valuable context. Pain is always a personal experience that is influenced to varying degree by biological, psychological, and social factors. Pain and nociception are different phenomena. Pain cannot be inferred solely from activity in sensory neurons. Through their life experiences, individuals learn the concept of pain. A person's report of an experience as pain should be respected. Although pain usually serves as an adaptive role, it may have adverse effect on function and social and psychological well-being. Verbal description is only the one of the several behaviors to express pain. Inability to communicate does not negate the possibility that human or non-human animals experience pain. Well, to make it easier to understand, perhaps every person has a different ruler of pain. So, if the patient complains of a pain, it is invisible, but there certainly should be some discomfort there. And the pain clinician must work something out to eliminate their discomfort. The pain cycle is initiated when painful stimuli result in reflex muscle contraction and localized muscle splitting. The localized muscle guarding restrict movements and decrease local circulation, which restricts the amount of oxygen available to the tissue and the removal of metabolic waste. The subsequent swelling creates less circulation and more pain. This is called the secondary pain, and it will lower down the pain threshold. From this point, muscle splitting is intensified and the cycle repeats itself to exceed the original discomfort. If this cycle continues, the patient would likely to feel anger, fear, or panic that leads to depression by the never-ending cycle of pain. And if the one's mindset becomes poor, the social activity is reduced, feel isolated, it would continue to get worse physically as well as psychologically. Therefore, we need to cut off the bad cycle of pain. So, let me talk about how we assess pain. The visual analog scale, VAS, measures pain intensity. VAS consists of 10 centimeter line with 2 endpoints representing 0, no pain, and 10, pain as bad as it could possibly be. We ask the patient to rate their current level of pain by placing a marker on the line, using a ruler to measure the distance in centimeters from no pain marker or 0 to the current pain mark. This provides a pain intensity score out of 10. For example, if the patient marks 6, we say the VAS is 6 out of 10. There are many types of pain. The sensation of pain involves communication between nerves, spinal cord, and brain. Pain differs depending on the underlying cause, severity, and type of pain. Several types of pain exist as shown in this figure. Pain is divided into acute and chronic. Chronic is divided into 4 categories: nociceptive, neuropathic, mixed, and visceral. Nociceptive and neuropathic pain are generally common. Nociceptive are what we often see as osteoarthritis, rheumatoid arthritis. Neuropathic is divided into 2 categories: central and peripheral. Central are post-stroke or spinal cord injury. In peripheral, because of COVID-19 spread, there have been increasing population with post-herpetic neuralgia, so-called shingles. How about in your area? Do you have the same thing in your country? I suppose the reason why shingles had increased is due to the environmental stress and complicated social matters. However, the ones we encounter the most are the combination of the two, and those are the most common age-related degenerative disorders that many of the physicians simply ignore as age-related commonly seen symptoms. And what I want to emphasize here is that the pain clinicians are the physicians that do not diagnose. No matter what and how many diseases one may have, we are always there, not only to ease the pain, but also to comfort our patient. According to IASB, chronic pain is long-standing pain that persists beyond the usual recovery period or occurs along with a chronic health condition. 1 out of 5 is suffering from chronic pain at the age of 65 and over. Globally, with prevalence increasing with age, it is estimated that about 1.5 billion people have some kind of chronic pain. The symptoms are like the ones shown in the figure, which is about 40% musculoskeletal pain, 65% osteoarthritic neck and back pain, 35% peripheral neuropathic pain, 25% chronic joint pain. Chronic pain prevalence is expected to increase in the coming years due to the aging population, the increase in diabetes, and the increase in cancer survival rates, which I feel the numbers are increasing rapidly in the last decades and more in the future. In fact, Japan has the most aged population in the world, as nearly 1/3 of its population is already aged 65 and over. The numbers are only going to continue to grow in all developed countries in the future. That implicates chronic pain will increase in the future as well. Which highlights the question, is aging a disease? And can we stop suffering from chronic pain by preventing aging? Aging is biological changes over time that leads to decay and eventually death. Increase of the risk of chronic diseases such as diabetes type 2, heart disease, cancer, and Alzheimer's disease. Dr. David Sinclair, the well-known professor at Center of Biology of Aging Research at Harvard Medical School, has also referred to aging as common disease that should be treated like any other disease in our modern world. Aging is associated with various biological changes that can cause chronic pain. Therefore, we believe that focusing on new intervention that reverse aging could play a key role in pain management from now on in the 21st century. Now, the main conventional pain management are nerve blocks and medication. I have also been using acupuncture and Chinese medicine to help patients get a better metabolism and circulation. CBD tincture is also a good indication for insomnia and antidepressant. Supplements are the choice, especially if there are lack in certain nutritious element. Getting back to conventional treatment, nerve block is the injection of local anesthetics close to a targeted nerve or group of nerves to lessen pain. Various areas of pain requires different nerve block types. There are many kinds of blocks by the region of the pain you have. I will briefly go through the frequently used blocks. Satellite ganglion block, SGB, is a collection of nerve found at the level of the 6th and 7th cervical vertebrae. The nerves are in front of vertebrae. They are part of the sympathetic nervous system and supply the face and arm. Sometimes after nerve is sensitized by trauma, infection, or other causes, the sympathetic activity can cause pain. Blocking the sympathetic activity by anesthetizing the satellite ganglion or a laser may stop the pain. It also used for reflex sympathetic dystrophy, sympathetic maintained pain, or complex regional pain syndrome. There are many blocks by the part of the face. Ophthalmic nerve block for eyelids and scalp. Anesthetizes the ipsilateral forehead, frontal scalp, and sometimes the upper eyelid. Supraorbital nerve block for forehead is useful in the treatment of painful condition of the frontal nerve, a branch of the trigeminal nerve 5, first branch of the trigeminal nerve. Infraorbital nerve is a branch of the maxillary nerve, which is a branch of the trigeminal nerve 2. It's for lower eyelid, upper cheek, part of the nose. A maxillary nerve block is a procedure that provides regional anesthesia to part of the nose, upper jaw, cheek, and mouth. Cervical, thoracic, and lumbar epidural block cause a loss of sensation of chest and abdominal, upper or lower extremities. Temporarily numbs the spinal nerve, which then blocks pain signals in a certain region of your body, depending on where along your spine the local anesthesia was injected. Epidural anesthesia can provide temporary relief or temporary total lack of feeling. We aim to start the block treatment at least once a week for 10 sessions to see and observe the effect. Medication is as shown. Acetaminophen, drugs such as Tylenol, dulls pain receptors in the brain. Non-steroidal anti-inflammatory drugs lowers the production of prostaglandin, include aspirin compounds, Excedrin, Advil, or Aleve. Antidepressant work for chronic pain, including migraines. The largest pain relief comes from tricyclics and serotonin norepinephrine reuptake inhibitor, SNRI, such as Effexor and Cymbalta. Medications for epilepsy interrupt pain messages to the brain. Types include gabapentin and pregabalin. These medicines can ease nerve pain and fibromyalgia. Muscle relaxers reduce pain by relaxing tight muscles or spasm. Opioids are a lab-made narcotic. They change how your brain perceives pain messages. Until 1990s, it was required to take as many opioids as to ease pain. However, it caused addiction and became a social problem. Many people from back then are still suffering from addiction. Because they can be addictive, they are rarely prescribed for chronic pain. Corticosteroids are strong anti-inflammatory drugs. Steroids such as prednisone treat migraines and severe arthritis and back pain. Until recently, I used to say, like any other doctors, to the patient to give up recovering totally and try to live with the pain, which was crucial because the conventional treatment only eliminates pain temporarily. But now our clinic does not, but treat pain using multidisciplinary approaches, which are regenerative medicine, orthomolecular DIB medicine, photoimmunotherapy, orthopedics, and rehabilitation. And those treatments has changed my way of thinking towards pain management. Please watch the video taken recently. Then I will explain each treatment briefly. Lastly, we'll go over several more cases which have successfully overcome their concern. The case in the video is a 63-year-old female who has a history of more than 20 years of rheumatoid arthritis and hypertension. She had been working as a pharmacist and has 2 more years before her retirement. Her family consists of her husband, son, the son's wife, and the baby grandson. She came to the clinic with a left ankle leg and swelling. She had been seeing the doctor, but none of the treatment worked to eliminate the pain. At the end of her day, she said that she no longer has strength to go up and down the stairs. She wakes up at night by pain. She was not able to get a good night's sleep for months. We had a thorough consultation with her and the family and understood her wish to continue working and get better, to have more fun with the grandson. Her dream was to go mountain climbing with the grandchildren. Wishing her to have a brighter future, we proposed her to take the stem cell therapy. Stem cell therapy in our institution is one-day therapy starting from 1 hour liposuction and 2-hour process to extract stem cells from the fat. And finally, inject locally as well as intravenously back to the patient. We are talking in Japanese, but there is subtitle underneath in English.
もうあなたにやれることは何もないんですと言われると、どうしてもですね、未来に希望が持てない、そういった状況になるので下げ込みがちになる場合があるんですけども、こういう治療がありますよというふうにご提案したところから、やはりですね、未来に希望をお持ちになった。
孫と一緒に山登りができたらいいなと。もう6年ぐらい前ですね。やはり一日中立ってる仕事なので、足首にしびれが来たりとか痛みが出たりとか、日々痛み止めで対応していました。痛み止めを飲んでてもやはり4時間か5時間で痛みが出てきますので、夜寝る時に足がつったりして夜なかなか眠れないっていうことはありますね。不安はあるんですけれども、手術をやることによってその痛みが多少でも軽減すればやった甲斐があるかなと思ってミューズシティクリニックに受診しまして、痛みの、状況を先生にお話ししまして、先生の方が関節に幹細胞を入れることによって痛みが和らぐことを教えていただきまして、最新医療で機械も揃ってるし、先生方も素晴らしい先生方が揃っておられますので、安心してお任せできるかなと思って選びました。
下西さんは年齢を重ねるとともにですね、その関節の痛みの症状が増してしまったということで、もう何をやっても良くならない、いろいろと考えを巡らして幹細胞治療に行き着いたわけなんですね。夜間どうしても痛みがあって目が覚めてしまうというような現状があって、睡眠不足であったりっていうような状況がですね、垣間見られるんですね。大抵の方っていうのは痛みが激しい時ですね、痛み止めの飲み薬、それからリハビリテーションなさる方もいらっしゃいますし、あとお注射などを併用される方もいらっしゃるんですけども、これ以上痛みは取れないよ、もうあなたにやれることは何もないんですと言われると、どうしてもですね、未来に希望が持てない、そういった状況になるので下げ込みがちになる場合があるんですけども、こういう治療がありますよというふうにご提案したところから、やはりですね、未来に希望をお持ちになった治療を控えているところではありますけども、明るい笑顔で診察にお越しになりますし、もちろん治療後もですね、私どものサポートですねを十分な体制を取りながらですね、精神的なものに関してもですね、十分なサポートをしていきたいというふうに思っております。
めっちゃって、
それで一応、お顔の注入しようと思ったんだけど、なんか私の大切な姉妹さんを傷物にしてって言われたので3時ぐらいには終わるかなと思いますので、最後整形外科の尾崎先生が来て、足首の関節内の方に麻酔、この間ちょっとトラマールっていう麻薬を使ったので少し気持ちが悪かった。体の写真を撮るので、今日9時半に入っていただいて、麻酔がかかるのが大体30分で、その後に脂肪吸引が30分程度で終了いたしますので。
皆さん、お背中の方、奥の方まで痛み止めしていきますよ。ごめんなさいね。お背中押されますね。
当院で使っている機器なんですけども、特に脂肪吸引器に関してはいろんな脂肪吸引器あるんですけれども、先端にレーザーが搭載されていて、脂肪を柔らかく溶かしながら優しく吸引していくようなタイプのですね、機械になっていて、で私が導入した頃はまだ日本には数台しかなかったというぐらい稀有なものなんですけれども、要するにその優しく溶かしてですね、脂肪を吸引するということがミソで、そうすることによって脂肪細胞をですね、壊すことなくですね、吸引する。壊さないで脂肪を吸引するので、やはり出血なども少ないわけなんですね。ですので取った脂肪を、何回か洗浄して、それから細胞を取り出すんですけども、その洗浄の回数も非常に少なくて済むということで、時短にもつながる、そういった優れものになります。 脂肪を抽出する機械においては、本当に国内で初の承認機を使わせていただいておりまして、これは徐々にその保険適用にも広がりが見られるような状況にまで、今日至っているものですね。でそういったものを使っておりますので、非常に安全性が高くですね、なおかつ時短で幹細胞を取り出すことができるので、通常培養してですね、皆様に提供されるっていう施設様が多いんですけれども、当院の方では手術が終わった段階ですぐにその細胞から幹細胞を取り出して、で同日に患者様に提供することによって、コンタミネーションといって、そのですね、細胞に雑菌が混入してしまったりとか、あと培養することによってやはり元の細胞からまたちょっと形質が変わってしまったものに変化することがあるんですけども、そういったことに関してはなかなかまだ研究がなされておりませんので、そういったリスク性というものも全て排除した状態で安全の高い細胞を有効利用することができる、これが当院の治療の特徴です。
大丈夫です。はい。じゃあですね、ベッドあげますので、お疲れ様でした。大丈夫かしら。無理ですよね。大丈夫です。どうかしら。力入ります。入ります。大丈夫です。足動きますかね。ベッド下げましょう。
でここから打つんですけど、全体にいきますので、はい。
一応先に入れてから渡せばいいのかな。
今の状態で取ってきて
幹細胞ね、ウォーミング効果と言います。点滴の方からと、あと関節の方からと、はい、
しょうがないと思います。足関節打ちづらいんで、一度これで打って、とねチクッとしますね。今です。はい。ちょっとねずーっときますね。良くなると思います。
ありがとうございます。
で歩けそうだったらそのまま帰っていただく大丈夫だと思います。
痛みも全くないし、これで痛みが止まれば最高です。普通に歩けます。ありがとうございました。
大丈夫ですか？
お腹も痛みもないです。はい。
足大丈夫ですか？
足も大丈夫です。はい。普通に。
足踏みできますか？
ごめんなさい。足踏みはできます。このように。はい。痛みも全くなくて、ありがとうございました。
歩いて帰っていただけそう
はい
なので、
はい。ちょっと靴はちょっと包帯巻いてるからダメなんですけど、歩けます。ありがとうございました。
すいません、お休みの貴重な時間ありがとうございました。ありがとうございます。
ありがとうございます。
久保さん、ありがとうございました。良くなるといいんですけど、本当に。
良くなると思います。
はい、ありがとうございます。お疲れ様でした。先日の下西さんの脂肪吸引なんですが、240cc ですね、脂肪が取れまして、そこからですね、細胞が8500ほど取れております。でそれを使って、治療させていただいて、経過を見ておりますが、先ほど整形外科医にも見てもらいましたけども、いい結果を得られているような状況ですから、これが終了というわけではなくって、しばらく半年から1年後ぐらいかけて経過を定期的に点滴をしつつ、あるいは、リハビリなども継続していただきながらですね、様子を見ていくというような状況になっていくのかなというところです。
実際オペを受けて不安はあったんですけれども、病院のスタッフの皆さんが優しくて、先生も事前によく説明してくださったので、安心してお任せすることができました。2週間後にちょうどリハビリがありまして、その時に行った時に片足が立つことができるって言った時にリハの先生は驚いておられました。 土曜日オペして月曜日から普通に仕事はしておりました。痛み止めさえ飲んでいればお腹の痛みもなく仕事ができましたので、本当に日帰りオペってこんなに簡単にできるっていうことを実感いたしました。痛みに悩んでいる人がおられましたら、ぜひ先生のところの戸を叩いていただけれたらなと思っております。
There are types of regenerative cells. iPS and embryonic cells are the most promising ones. But the research is still undergoing, and yet there are immunological concerns, ethical problems, and the risk of getting cancer, so that it is not yet possible to use them in our real-life practice except for cornea. Whereas mesenchymal stem cell can be obtained from your own body, usually from bone marrow, adipose, or dental pulp. Recently, the role of stem cell has become well recognized in promoting anti-aging by replacing apoptotic and necrotic cells with healthy ones, as well as their anti-inflammatory and anti-apoptotic properties by growth factors and cytokines on the site of administration. Among three mesenchymal stem cells, autologous adipose-derived stem cells are the most common because they can be easily harvested in huge numbers with minimally invasive liposuction, and even without culturing, you may be able to collect nearly 1 million of cells, so that it represents a strong tool for anti-aging properties. Autologous adipose-derived stem cells particularly have the ability to regenerate cells in bones, cartilage, muscles, nerves, and tissues. Moreover, they can reduce inflammation by releasing specific cytokines. The outcomes are different by the patient, but I've been seeing remarkable outcomes like the ones from the video. So currently, it is my first choice of the treatment for any type of rage-related pain. In addition, other regenerative therapies can be provided and serve as an effective option for chronic pain who are not fit to undergo fat cell extraction from their own body. These therapies include the following: stem cell supinating fluid therapy, by injecting the patient with cell-free serum obtained from allogenic stem cell cultures, which provides similar regenerative effects and reduce inflammation like autologous stem cell therapy. Particularly for the ones who do not have enough fat, ones that do not have the condition to have liposuction, such as someone who is taking thrombolytic agent, or someone who does not have enough strength to be anesthetized, or simply does not want to do liposuction. For the full body maintenance, such as sequelae of injury or cellular aging from cerebral infarction, etc., constant DIV treatment is recommended, but if there is a pinpoint focus, such as joint or local nerve, I inject directly into the damaged area. Platelet-rich plasma, well known as Prp therapy, has also been used widely for pain relief. By obtaining growth factors and cytokines extracted from the patient's own blood, this therapy has shown improved result in reducing pain in conditions such as tendonitis, joint pain, and osteoarthritis. This treatment is especially popular among the athlete who jogs or plays soccer, golf, and tennis. It is a 1-month treatment for 3 sessions, and rehabilitation for 6 months to 1 year is needed. Finally, ACRS, autologous cytokine-rich serum, which you can obtain incubating by blood for 3 hours in the special kit called Cytokine, and extract the serum, can also provide a powerful biologic for fighting inflammation for any kind. Specifically, the anti-inflammatory compound interleukin-1 receptor antagonist can be more than 500 times higher than the original serum before incubation. Compared with PRP, ACRS provides a stronger anti-inflammatory, yet PRP delivers a longer-term effect. I prefer to use this therapy for the ladies who lost the vaginal elasticity after menopause and have pain during intercourse, in combination with the transvaginal laser treatment. Moving on to the second element of our multidisciplinary approach, I'd like to briefly introduce the 4 effective orthomolecular DIV medicine in chronic pain management. Firstly, high concentration vitamin C intravenous therapy, a well-known antioxidant. However, worth mentioning, high vitamin C has also strong impact on inhibiting ROS and neuropathic pain and the release of neurotransmitters required for pain pathway inhibition, such as norepinephrine and acetylcholine. Myers cocktail intravenous therapy has been also used at our clinic for fighting inflammation for any type of pain, but particularly migraine, fibromyalgia, and chronic fatigue. The cocktail is injected into the bloodstream directly, containing vitamin Bs, vitamin C, magnesium, and calcium, thus providing the essential element to fight inflammation. The effect is much quicker than the supplements. It is a basic DIV therapy that anyone should receive during pain management. One of the major orthomolecular infusions that are highly considered at our clinic for chronic pain patients and have shown evidence of anti-aging effect as well as anti-inflammatory effect is nicotinamide mononucleotide, NMN intravenous therapy. Harvard Medical School and Keio University researchers from Japan have discovered a rejuvenating effect in research which withdraw many clinicians' attention recently. The administration of NMN provides an increase of the cellular NAD, which in turn can act through the following mechanism. 1. Increase the cellular NAD level and antagonize the expression of interleukin-6 and interleukin-1 beta. 2. Decrease prostaglandin E2 production and decrease cyclooxygenase 2 expression. Interestingly, NMN activates sirtuin gene. Sirtuin is gene, as you may know, is responsible for improving physical functions such as skin cells, physical strength, and fatigue, as well as rejuvenation. My father, 79-year-old, who received NMN therapy followed by 3 sessions of stem cell therapy, had examined the length of telomere. A telomere is a region of repetitive nucleotide sequences associated with specialized proteins at the end of linear chromosomes. Telomere is known to get shorter as you age. Surprisingly, after 3 sessions of stem cell therapy and NMN, my father's telomere was as long as that of a 13-year-old child. I need to have more cases examined, but this certainly can be one of the evidence that stem cell and NMN in fact does reverse aging. Finally, I'd like to talk about ozone therapy. Medical oxygen O2 is used to make ozone O3. When the ozone enters the blood, it destroys all viruses, yeast, mold, fungus, bacteria, spirochetes, and parasites, as well as harmful toxins and harmful free radicals. Ozone has also been shown to chelate toxic material from nerve tissues that normal chelation cannot. Ozone can display a number of beneficial effects, including inhibition of inflammation, and correction of ischemia and venous status. I like to use the gas for the acupoint injection, where ozone DIV therapy is especially good for fresh postherpetic neuralgia to fight against virus and fix their immunosuppression. Proceeding on to the next element of our therapy is photoimmunotherapy. MLDS, multi-laser delivery system, is considered one of the effective ways that can treat chronic inflammation and various types of underlying disorders that can cause pain. Photoimmunotherapy, in another word, near-infrared immunotherapy, developed by Dr. Hisataka Kobayashi, a senior researcher at the National Cancer Institute, Japan. This treatment has been introduced and approved in more than 800 units and in 30 countries around the world. Unlike other therapeutic devices, the MLDS works by using light to trigger specific biological reaction on a cellular level, similar to how plants get energy from the sun through photosynthesis. There are 6 different lights emerge from the device, and each color has a different effect. It is recommended to use all colors at a session from infrared, red, yellow, green, blue, and UV that represent low and higher energy level of dawn to sunset. I prefer to use red and yellow because it enhances natural defense and antidepressant effect. By treating cells from inside out by inserting the light fiber directly into the vein, tissue, interarticular, or to be used to sedate nerve instead of blocking by the anesthetics. It increases blood flow, promotes tissue repair and remodeling, stimulates the immune system, improves lymphatic drainage, and reduces swelling, enhances the body's natural healing process. MLDS has shown clinical effectiveness in chronic pain syndrome, rheumatoid arthritis, polyneuropathy, chronic inflammatory disease, and cancer. I bought this device because I heard a good reputation about it from a close colleague of mine. At the time, I had sick Mario. Mario, my dog, the 14-year-old golden retriever, was treated with MLDS for a while because of the skin cancer and joint pain by osteoarthritis. I put him onto MLDS for more than 10 sessions. His cancer was smaller and was able to walk without any assistance for a while by the treatment. Unfortunately, he passed away last September. But thanks to MLDS, his terminal stage was not bedridden and was able to maintain a good quality of life until the very end of his life. Lastly, to ensure that our patient receive a full support for recovery and restoring function during chronic pain management is orthopedics and rehabilitation. We ask patients continue coming even there is no medication. Merely coming to visit, make a good social contact, and the communication and exercise with a physical therapist can ease the muscle and mind. When patients experience pain for a long period, the body reacts by reducing movements that stimulate pain, as well as psychological responses such as depression and poor mood. Therefore, rehabilitation and orthopedic therapies can play an important complementary role in ensuring that the patient improves physically while recovering by maintaining the range of movement frequently and skeletal muscular system use, allowing full recovery from pain and returning to their active lifestyle. Now that you may have a good idea of multidisciplinary approaches, I will be showing you 3 more cases that showed good outcomes. This is my father again, 79-year-old male, The picture is a day after liposuction and a facial fat implant. Isn't he shiny? He has spinal canal stenosis on his L4 and 5, also hypertrophic cardiomyopathy. His VAS was 5 out of 10. His concern was intermittent claudication by pain and palpitation during a light stroll. Stem cell therapy was performed 3 times in 2 years. In between the surgery, he had regular high-dose vitamin C of 25 and MNN. After the 3rd session, VAS was 2 out of 10 and less palpitation during walk. 64-year-old male, elbow pain during golf and diagnosed as tennis elbow. He tried intra-articular steroid injection, but there were no improvement. So he decided to try PRP. After 3rd session, his VAS was 1 out of 10. 66-year-old female who had a fresh shingles on her left trigeminal nerve 3, and there were annoying sensation by wearing mask and insomnia by pain. None of the medication nor the blocks worked for her, so she tried ozone and Maillard cocktail and CBD tincture. After 3rd sessions, she felt that she was totally recovered from pain and insomnia. Chronic pain patients achieving full recovery require multidisciplinary approaches. Managing aging by regenerative medicine is one of the major interventions in chronic pain management. Autologous adipose-derived stem cells can largely contribute to reducing pain, inflammation, and alleviating the underlying cause. Orthomolecular DIB therapies act efficiently as a complementary element in chronic pain management. MLDS is a must-do tool to heal the tissue injury inside out. Orthopedic assessment and rehabilitation is an essential element of therapy after multidisciplinary therapies. Pain clinicians should provide tailor-made therapy that fits the patient's need and expectation by considering such multidisciplinary approaches. Thank you for listening. I hope the presentation was understandable and that I didn't use too many unfamiliar terms. If you have any question, please feel free to contact me.